In the studio with us today, Dr. Kevin Kavanagh, who's the retired ENT from Somerset. He also founded an organization called Health Watch USA. Good morning, Kevin.
Oh, good morning, Jack.
And Kevin always brings really big-time, hard-to-get guests with him, and you've done it again, Kevin. Tell us who you got with you today.
Yes. Right now, we have on the line Dr. Michael Bell, who's the Deputy Director of the Division of Healthcare Quality Promotion at the CDC. And also in the past, he was the Chief Epidemiologist at the Viral Special Pathogens Bank at the National Center for Infectious Disease. So he has a wide range of infectious disease experience. He's really a top official, well-known expert around the nation. And we are very, very privileged to have Dr. Bell on the line.
Good morning, Dr. Bell. Thanks for being with us.
Good morning, everybody. Thanks for having me.
We're glad you're here. And along the way, if you have a question or a comment for Dr. Bell, the numbers are 253-5959. Touch star 590 from AT&T. We have several things we'd like to talk about with you this morning, Dr. Bell. One in particular is we have had an unusual number of cases of hepatitis A in our state, and they've been reported in people who are in the restaurant business, mostly fast food, and was wondering, first of all, if you could tell us a little bit about hepatitis, the differences in between the various kinds, and is this a trend beyond Kentucky, or is this something that is common just to our state or our part of the country?
No, it's not just Kentucky that's being affected. So hepatitis A is something that has caused infections in humans for centuries. It continues to crop up periodically. And hepatitis A is the hepatitis that comes from contaminated food and water, as opposed to hepatitis B and C, which tends to be more related to injection drug use or sexual contact, things like that. So hepatitis A is very different from the other ones. And it comes basically from human poop. That can be because of not cleaning your hands while you're preparing food, if you happen to be infected, or it can be contamination of produce somewhere in the process of creating food for distribution, either on a farm or in a processing plant. Contamination can happen there from dirty water used for irrigation, et cetera, et cetera. So there are many ways for it to enter into the food stream, but if it does, then it can cause a very, very bad infection that makes people very sick for a couple of months. In some cases, if you're older or you have a weakened immune system, it can actually cause a really severe meltdown of the liver, which ultimately kills the patient.
Wow. So this is nothing to fool with. If someone is in the food industry and has contact with the preparation of food, obviously that's a huge red flag.
Well, so, the way to think about this, it gets back to the overall hygiene need. We're talking about hepatitis A, one particular virus that comes from human feces, but there are many bacteria and other pathogens that can come from human feces, and we just don't want it in our food, right?
Right.
So whether it's safe food preparation, hygiene in the kitchen, proper management of the production chain, there are many things that need to happen all the time, not only to prevent hepatitis A, but to make sure that we have clean food. The same thing is true with drinking water. We want to make sure that our drinking water is safe from many different contaminants, not just hepatitis A.
That is a huge problem, and it's something that really a person who goes out and eats can't prevent on the restaurant side of things,
right.
But you can prevent you getting hepatitis A by getting a vaccine. And that is very efficacious. They work. I've been immunized against A, B, and it is just a huge, huge factor in preventing these infections.
Is that one shot or is that more than one? Is that two different injections?
I believe I had two, but it was some time ago. I had to have a booster. And of course I had this as a surgeon, and they are effective. And it's something that I would encourage everybody to get. And I know that there are a lot of people who are down on vaccines. We hear a lot of things about the flu vaccine,
right.
But vaccines are different depending upon which one, just like drugs are different. And the flu vaccine this year wasn't good. I called
wasn't effective, was
it? Yeah, it was. I called it 10% vaccine. I got it. I got a 10% coupon for 10% off groceries, and it's 10% effective.
Why was that, Dr. Bell?
Well, so flu viruses change every single year. It's a moving target. If you think about how flu ends up in this country, it actually starts in Asia, moves with wild birds, and keeps changing the entire time. So what we look at the beginning of the process of making a vaccine might not be what we end up with, and there's no way to control that. The time that it takes to produce enough vaccine to start giving to people at the right time of year means you have to start early, even though you understand that there can be changes in the virus that ultimately lands in the country.
Now, if you would address just a little bit, you don't have to go into great detail, but just tell us a little bit about the type A and type B of the hepatitis.
Sure. I'll also include type C since they kind of all go together.
Yeah.
Hepatitis A is the one that's foodborne. It doesn't tend to cause a chronic infection. So if you survive it, you're pretty much done. You're going to feel terrible for a couple of months. But as long as you're not one of the very elderly or immune-compromised individuals who have really severe infection that kills you, you will get better and then you'll be immune for life.
Okay.
Hepatitis B and C both can cause chronic infections. In other words, the virus stays in your liver for years and years and years. Much more common with hepatitis C than hepatitis B. And the good news here is that for both hepatitis B and C, there are better and better treatments that have been developed through the years. For hepatitis B, there's a very good vaccine series, so you don't have to catch it at all. We don't have a vaccine yet for hepatitis C, but we do have treatment.
So should everybody receive that vaccine, in your opinion, or who should receive it?
Oh, if it's me, I would get hepatitis A and B vaccines just across the board because there's no need to suffer from such a severe disease.
Any other vaccines that you recommend and to whom?
Oh, gosh. So I'm not going to go through all the vaccines because there's a large number of them. They're the standard childhood vaccines that, you hear a lot of controversy about. But the thing that isn't controversial is that they've saved millions of children's lives over the years. When we think back to our grandparents' and great-grandparents' era, when families lost several siblings every year from severe outcomes related to measles and mumps, chickenpox can be lethal. There are these severe diseases that we no longer think about thanks to vaccines. Another good example of a successful vaccine is tetanus. People used to die from farm injuries and other injuries because of this dirt-based.
Dr. Kevin Kavanagh is in the studio with us, and Dr. Michael Bell, and he is with the Center for Disease Control and Prevention. And we got a whole bunch of texts, but before we do that, let's go to the phones and start with Ed. Good morning, Ed. You're on the air.
Good morning. I'd like to ask a question about the realism and feasibility of mass vaccinations. When I was a young guy, years and years ago, they came up with a polio vaccine, and they had a public program. We all went to the high school on a Sunday afternoon, and they put a sugar cube on our tongue. I remember when they invited everybody in to try to eradicate rabies, and they invited all the farmers to bring in their dogs to the local school, and they vaccinated all the dogs. My question is, how come, is it feasible to give mass flu vaccines to people rather than me have to make an appointment with my doctor and wait for an hour and fill out all the paperwork? Couldn't we do it more efficiently and effectively with mass programs?
We do have drive-by flu shots, and you can get those at grocery stores. That's how I had my 10% off coupon. And so it's a little bit more efficient than, for example, a measles or mumps vaccination. But the flu vaccine has been covered in some controversy because of it's not always that effective. And so to me, that's not a vaccine that I would push for mass vaccination. But when you talk about hepatitis, when you talk about mumps, measles, these are types of vaccines which are well-founded, work well, and really people need to get them.
Dr. Bell?
Yeah, no, I think that there are decisions to be made from a policy perspective of how you're going to invest your efforts. For things that are once in a lifetime or once every 10 years, that kind of vaccine, it might make sense to do a vaccination campaign like you're describing. It might be harder to support that year after year. I will say, though, that for occupational vaccination, so thinking about hospital workers, for example, we see terrific success in getting people vaccinated when the healthcare system, the facility, actually provides the vaccine and brings it to the wards where people are working. So bringing the vaccine to the people as opposed to having them make appointments and stuff certainly makes a big difference.
All right, let's go to Dorothy. Hey, Dorothy, you're on. Good morning. Thanks for calling.
Good morning. Thanks for letting me call.
Sure.
And I have a question, I guess, for Dr. Bell.
Okay.
If hepatitis A is foodborne and hepatitis C is through bodily fluids, how do you get a contact with hepatitis B?
So hepatitis B is also through bodily fluids, more often through sexual contact, but it can also be compared with hepatitis C, but it's also commonly transmitted through injections. And so what we see for both B and C, and especially with C, is either people who are injecting drugs illicitly, or when medical care is delivered and people don't do the right thing with safe injection. We want to believe that everyone knows that you don't ever reuse a syringe, but sometimes we discover people doing that. And it can be because they didn't realize that just changing the needle isn't good enough, or it could be that they were just being lazy. But for whatever reason, we never want to see reuse of needles or syringes, even when you're just going back in to reload from a vial of medication. You need a fresh syringe and a fresh needle every time.
Dr. Kavanagh?
Thank you so much.
Sure.
Yeah, I kind of wonder if some of that wasn't a problem in putting my age group at risk for Hep C. Those that were born between the years of 45 to 65 are at risk for hepatitis C. The CDC's recommended that we all get tested. Well, I mean, I don't think our age group, in fact, I think we did less drugs, less sexual activities, et cetera, than what is currently going on, but yet we're at higher risk. So, I mean, what placed us at this high risk?
Well, there are several things. One is that you really can't do anything about something that you can't test for. And we know that being born to a mother who has hepatitis C puts the child at risk of having chronic hepatitis C as well. So there's that part of transmission that before we were able to test, there was nothing we could do. Today, because of the availability of things like immunoglobulin and so on, there is an opportunity to try and reduce that transmission. And then I think you're right. There's also the likelihood that there was unrecognized cross-contamination related to medical care. We can't prove it one way or the other from 80 years ago or 70 years ago, but the fact that we still see these mistakes happening makes me not at all surprised to think that they were probably happening back in the day as well.
Let's go to a couple of texts, and then we'll take a quick break. Here's one from our Atlas Contracting text line. Says, can you please ask your guest, what's the gamma-globulin shot, and what is it? Does it last forever? When I was in the Navy, we got quarantined on our ship and had to take that painful shot because of one of the cooks that had a version of hepatitis. That's from Rob. What is that?
Great question. So in the absence of a vaccine, there is the possibility of giving people immune globulin. So immune globulin is the protein that our livers produce and our immune system produces that float around in our bloodstream, in our tears, basically sticking to viruses and bacteria and inactivating them. So it's our sort of roving immune system. And one thing that's been done in the past and is quite effective is to take that immune globulin from other people who have immunity and inject that into folks who might have been exposed. The only problem with it is, number one, it does hurt because it's kind of a large volume injection, but it's also temporary. So just like any other protein in our body, it gets used up and filtered out, and ultimately it's gone in a number of weeks. But as a short-term thing, if you might have been exposed to block an infection, that kind of injection is something that we can still use.
Here's a text that probably has to, the fact that they're asking this question had to do that there was a rabid bat that was found in someone's bedroom in Lexington this week, and it actually bit the resident. And this is a question from our text line. It says, years ago when I worked at a local hospital, we had a patient with rabies, and as you know, when symptoms appear, there's no cure. We had to dress in spacesuits to administer care. The patient never told us until it was too late that he had been bitten. Any comment on that?
Well, rabies is a terrible disease. It's something that we always want to remind people that if animals are acting strangely, that can be domestic animals that you're not familiar with, but also wild animals like bats, raccoons, foxes, you name it, possums, they can all carry rabies. And the best policy is to stay away. The other thing to remember is that if you're in a profession that causes you to come into contact with animals like that, then whether you're an exterminator or an animal control officer or a veterinary technician even, there is a rabies vaccine series that's pretty effective, and it very much decreases your risk of dying from rabies. The other thing is, if you are bitten or have even contact with, you might not recognize that you were bitten, especially by a small rabid bat. Their teeth are tiny and razor sharp, but even a brush bite can be enough to become infected. And so take it seriously, because if you get treated right away, you can have a preventive vaccine that will keep you from getting an infection.
We're going to be right back. And in the studio, Dr. Kevin Kavanagh, and on the phone with us this morning, we have Dr. Michael Bell with the CDC, and folks holding. So let's go back to the calls. This is Lindsay. Hey, Lindsay, thanks for holding.
Good morning, Jack. It's an honor to talk to you, doctor. And question, I had a hepatitis A and B vaccine. It's been about 7 or 8 years ago. I'm not sure which. For that question. My second one is, it's mandatory for our kids to get hepatitis A this year. What is the recommended booster? Should I get a booster for that when I take my kids for theirs, or?
That's a great question. So from what we know, there's no firm requirement for a booster for adults.
Okay.
The series for the initial vaccine is the first one followed 6 months later by the second part of the series,
right.
and you should get both. But there is no recommendation right now for an adult booster. That could change, but that's what we know for the time being.
Okay, perfect. And is that the same for the minors as well? Because I have a teenager and an 11-year-old, 15 and 11.
Yeah, so whether you get it as a little kid or whether you get it a little bit later in life, there are 2 shots. You get them both, and you should be good for a good long time.
Okay, perfect. One more, and chickenpox booster. How often do you get that?
Oh, I have to look that up. I don't know that off the top of my head.
I got you.
Okay, thanks.
Thanks.
Here's a text that says, can you ask the doctor why people don't develop an immunity to seasonal allergies? Mine seems to be worse this year than in years past.
Wow. Well, so the thing to remember is that your allergies are an immune reaction. So it's actually your immune system reacting to things like pollen or dust or pet dander or whatever it is, going a little too far. So rather than just protecting you from foreign material, it's causing you to have all these extra symptoms. So it's actually too much immune reaction. And that's why things like if you have a severe allergic reaction to something, your doctor might put you on cortisone to turn down your immune response.
Yeah.
That's what's happening. So it's not about developing an immunity. On the other hand, you can become tolerant. So there are instances in which if you have ongoing exposure to the same allergen, so the same pet dander or the same pollen constantly, you can basically wear out your immune response and you'll start reacting less and less. And that's how the allergy shots that you've heard about work.
Okay. Another call. Did you have anything, Kevin?
I agree. As most things in life, a little bit is good, excess isn't. And that same is true with our immune system.
This is Jim. Good morning, Jim. Thanks for calling.
Hey, you all.
Morning.
I had a friend at work, and he's like 63, and he got the shingles, and he was miserable. And I'm 58. Is the shingles shot 100%, and should I go ahead and go on with it?
So nothing's 100%, but shingles is 100% miserable. So if you're at the right time of life to be thinking about getting vaccinated, I talk to your doctor and make sure there's no reason not to be, and then you can decide whether or not you want the shot. I personally am planning to get mine because I'm 54. I'm entering that window where the chickenpox that I had as a child can come back as shingles, and I really don't want that.
Okay. I thank you guys very much.
And is that just once a year, that immunization?
I think that's a one and done.
One and done, okay. Back to the phones. This is it Laura? Good morning, Laura.
Good morning, Jack. How are you doing?
Doing well, thanks.
I'd just like to ask the doctor from the CDC if they're having cutbacks on their funding for the developing the vaccines. I understand a few years ago in 2014, we had an Ebola outbreak, and there was a big to-do over that, and it faded away. And then Zika came out, and Congress, instead of funding research on Zika, they pulled the funding from Ebola to Zika. Did that mess up the Ebola program that was ongoing? Because this stuff needs to be funded over a long period of time. And are we having that problem with local problems, like hepatitis A research too? And another thing just to mention, Ebola's back in Democratic Republic of the Congo, and it's in a big city this time. Huh. So have they messed up our Ebola vaccine research?
Laura, you're breaking up a little. I'll let you listen to the answer off the air. Doctor?
Well, thanks for bringing that up. Resources are always an issue. We are always having to prioritize how we spend our efforts. And the good news right now is that the Ebola vaccine is actually being delivered to the Congo. So we have teams on the ground, and they're attempting to implement the vaccine to contain the spread of the Ebola outbreak so that people who are caring for individuals and people in those communities are protected and don't become sick, causing another wave of infection. So that's the good news. The reality is that everywhere we go, in every jurisdiction, we see the ebb and flow of resources focusing on one problem or another. If you have a city where they stop spending money on maintaining the roads, then in 5 to 20 years, you're going to have crummy roads, and someone will decide, okay, we need to go back and do something with this. Same thing is true with water treatment systems, and likewise, the research stream across the government and throughout academics, the focus on research shifts depending on what people are concerned about. That's a normal human action, and we have to make the best of what we've got. But like I said, the good news is we do have a vaccine that was produced during the last outbreak of Ebola, and that is being delivered to the Congo. So with luck, we'll see it be effective and reduce the amount of transmission that we see.
Let's go to Rebecca. Good morning, Rebecca. You're on the air.
Hi. Hey, Jack. Thank you for having him on.
Sure.
You really get interesting guests on and things we need to know about.
Thanks
Doctor,
to Kevin.
I have two questions. You said shingle shot is a one and done. Well, we took them when they first came out, but now this last year they've come out with a shingle shot that's not a one and done. I'm thinking you have to take it and then maybe take a second. I haven't talked to my doctor yet about this, but we did take the first one. The second question is, with the hepatitis A, which has me scared to death here in Fayette County, you go into so many places and they say employees must wash hands before returning to work. There's a lot of these places that do not have hot water in the restrooms that I've been in. You get cold water. Is cold water, if you wash with soap, as effective as hot water? And if not, that should be mandated that everybody has hot water in their washrooms. And now I'll hang up and listen to your answers.
Okay, thank you. That's a good question, Doctor.
Yep, so you're right about the shingles vaccine being 2 doses. I was wrong about that. We just looked it up. The bottom line with hand washing is that soap and water, regardless of the temperature of the water, works just fine. The challenge with cold water is that people might not want to use it. So warmer water can get people to wash their hands more often, but the cold water works just as well. The other thing to remember is that we have alcohol hand rubs, and those do a good job getting viruses and bacteria inactivated on your hands as well. So the temperature of the water doesn't really matter except for comfort. The other thing to think about is glove use. You see a lot of food service folks using gloves, and I'll remind everybody that gloves are only as good as how quickly you take them off. So if you leave them on all day, you're going to have dirty gloves. So if you're using them for food preparation, anytime you leave that food preparation work and touch something else, whether it's the door of the refrigerator or what have you, you need to take your gloves off and put clean ones on.
Okay, that's... Back with Dr. Kevin Kavanagh in the studio. We've got Dr. Michael Bell, who's with the CDC, on the line with us this morning, and we've got about 6 minutes remaining in the program. Before I go on, Dr. Bell, you're really a terrific guest. We really appreciate you being with us this morning.
Appreciate you having me. It's great to be on.
Let's see. Let's take some of these texts from our Atlas text line. New shingle shot have almost 90% protection. Older shingle shots only 45%. somebody wrote in. Let's go to the phones. This is Jerry. Jerry, good morning.
Jack and Doctor, didn't know if you talked about Lyme disease. I had deer tick. I had like 6 around my midsection about in the neighborhood of 20 years ago out walking the creek, you know.
Yeah.
And of course, I was aware of the possibility of the Lyme disease, and my doctor recommended, rather than testing for the disease, to go ahead and just he gave me a prescription that I took for 10 or 14 days. He said it'd be less costly and less trouble to do that. So what is the latest on the Lyme?
Well, so I'll start by admitting that I am not a Lyme disease expert. What I can tell you is that, first and foremost, whether it's using insect repellents or avoiding infested areas, if you can avoid getting the ticks on you in the first place, that's thing number one. Doing tick checks to make sure that if you have one on you, you get it off as soon as you can, because the infection doesn't get transmitted right away. So you've got a little bit of time to get the tick off before you're at risk of being infected. And for getting the tick off, plain old tweezers pulling directly straight out of the skin is the way to go. Don't do newfangled things with match heads and all that stuff. You'll just end up burning yourself. So get the tick off. And then the other part of it is having someone look at it if you suspect that there's anything going on. So most of you have seen or read that the ticks that carry Lyme disease bacterium, you'll end up with a target-shaped red ring around where you were bitten. And having that looked at is important if you see it, because then you can be treated with antibiotics. There's controversy about the chronic Lyme piece, so it's not clear how long this can last, what's causing it, or whether antibiotics are the answer for the chronic version. There's still a lot of work to be done there. What I can tell you is that being treated up front is fine for the initial acute infection, but longer-term treatment has been shown to have side effects from the antibiotic. So, for example, one of the antibiotics that gets used can give you gallbladder disease, and we ended up seeing a big bump in the number of gallbladder removals related to an increase in treatment for Lyme disease. So it's important to weigh the balance between early and prompt treatment versus longer-term treatments, and work closely with your main doctor to figure out what's going to be best.
Dr. Kavanagh.
I agree with that. And I think one of the overriding principles you need to realize is that we're still learning about Lyme disease. And recommendations today may not be recommendations tomorrow. The diagnosis could be much better than what it is today. And as was stated, the chronic treatment recommendations are not really well defined or studied. This is a disease which we're still learning about. Unlike other diseases that have been around for centuries, this is one that's been around for decades. And so I think the idea of, if you're bit, maybe on the best side of taking an antibiotic if it's at risk is not an unreasonable way to go, because in general, things that are treated sooner are easier to take care of than waiting until symptoms appear or it's chronic. And even if a target ring does appear, you are certainly going to get treated then, but if it doesn't, then you may miss Lyme disease. It's still in flux on what exactly needs to get done.
Doctors, I'm a little curious about if you get the same the Lyme from the deer tick versus the dog tick or the regular tick. I need to do some reading on that and see what other diseases are possible.
Yeah, and that gets way out of my field when you get into tick-borne pathogens. I mean, there are a lot of them. I can tell you that ticks are bad to get bitten from. And
any kind of tick.
Any kind of tick. And you really want to use the repellents. The people who are worried about the side effects of the repellents, so they don't use them, believe me, the risks from those repellents are much less than the risks from getting ticks when you're going on a stroll in the woods or going out to pick wild raspberries or something. You need to really suit up, put your pants inside your socks, and do a total body tick check when you get back.
Thanks for your call, Jerry. Appreciate it. We're out of time. Dr. Bell, thank you very, very much for being with us. We sure appreciate it.
You're most welcome. Thanks for having me.
All right. Thank you, sir.
And as always, Dr. Kevin Kavanagh, thank you.